Hi, so today we're gonna learn about first aid. So people usually have questions like what is the real definition of first aid and how can it be used in such emergency cases? So here it goes. So number one, of course, the first part we have our today's agenda. Number one is the introduction to first aid. Second is the first aid basics. Third is the three P's. Number four is the hand washing and personal protective gear. Number five is the first aid kit. And number six is the summary and conclusion of the topic. So, introduction. What is first aid? So, first aid is an emergency care given immediately to an injured person. The purpose of first aid is to minimize injury and future disability. In serious cases, first aid may be necessary to keep the victim alive. So, ang first aid, para siyang kinukonsider natin of course as a first na response in terms of different accidents and situations. Ano ito yung parang kaagapan upang hindi lumala yung kondisyon ng tao at para ma-promote yung wellness ng patient. So, the history of first aid. So, in 1870, Prussian military surgeon Friedrich von Bismarck introduced formalized first aid to the military and first coined the term Erste Hilfe, translating to first aid. So on this table, we have the types of first aid which requires training. So these are the several types of first aid and first aider that require specific additional training. These are usually undertaken to fulfill the demands of the work or activity undertaken. So these are the types of first aid and of course applicable to sa mga first aider na kailangan talaga ng training in cases like this to, of course, to ensure the safety and wellness of the patient. So number one is aquatic or marine first aid. Number two is the battlefield first aid. Third is the conflict first aid. Fourth is the hyperbaric first aid. Fifth is the oxygen first aid. Number six is the wilderness first aid. And number seven is the mental health first aid. So, the first aid basics. The first step in any emergency is the recognition of the problem and providing help. In doubt, or when someone is seriously injured or ill, you should always activate the emergency response system by calling 911. If you are not sure how serious the situation is, the 911 operator will ask you a series of questions to determine the seriousness of it. So, if you're in a situation wherein there is an emergency, if you know how to perform first aid, of course, you have to provide help. And if you need assistance and the condition of the patient is in critical, of course, you must seek help and seek assistance to 911 and call them because for sure they will respond as soon as possible. So of course, you have to remain on the line until additional help arrives or until the 911 operator tells you to hang up. Emergency system dispatchers can guide you through the steps of performing cardiopulmonary resuscitation or CPR using an automatic external defibrillator or AED or delivering basic care until additional help arrives. So, whether you are at home, work, or school, know where the first aid kit and the AED are kept and be familiar with their contents. Know how to activate the emergency response system by calling 911 if in the United States. Be aware of any policies in the workplace regarding medical emergencies. So, even if you are at home and then some emergency situation arrives, of course, you don't need to panic and you have to know where your first aid kit and you have to familiar with all the contents that the first aid have. So, in the Philippines, I think it's 911 also, or if I'm not mistaken, 119. But it is the emergency system that we need to call or that we need to dial in case of certain emergencies. So after determining the problem, the next step in providing help is to determine the unresponsiveness of the injured or ill person. The best way to determine this is to tap the person and talk loudly to them and say or ask, "Are you okay?" After determining unresponsiveness, yell for help. Look for any medical identification such as a necklace or bracelet. This may provide a valuable clue to the cause of the situation. One set of goals to keep in mind for first aid would be what we like to call the three P's. Of course, in some situations like this, you have to ask the person or to make sure that the person is in conscious state. And if they are not responsive, of course, you have to call 911 and yell for help. And you should also find some evidences or identification so that you can contact their family and they can help you with this matter. So here are the three P's. Number one is preserve life. Your main goal should be to keep the person alive. So, of course, number one is you have to make sure that the person you are performing in first aid is safe and he or she will not be dead, of course. It is your main goal to keep him or her safe. Number two is to prevent further injury. Keep the injured person safe and from becoming injured anymore. It is always recommended that you do not move them until help arrives. So, you should always keep in mind that in performing first aid, you should not worsen the situation of the patient and you should secure his or her safety and wellness. Number three is promote recovery. Try to help fix their injuries as best as you can. Of course, you have to try to help them to recover and to be well. If you don't know how to perform first aid, just don't do it because it might worsen their situation and it can cause them to be dead. Hand washing and personal protective gear. Hand washing is essential in the prevention of disease and illness. Wash your hands after each episode of care and after taking off the gloves. Also, be sure to wash the injured or ill person's hands at the first opportunity. When a sink is not available, use hand sanitizers. Because most hand sanitizers are alcohol based and are substitute for hand washing when needed. So here are the steps for proper hand washing technique, which is fairly simple. Number one is you have to completely wet your hands and generously apply soap, of course. Apply soap on even parts of your hands. And of course, you have to rub vigorously for at least 20 seconds. So you have to rinse your hands after with plenty of running water. And lastly is you have to dry your hands with a towel or air dryer. So when using personal protective gear, it is very important. It is an important strategy to minimize the risk of blood and bodily fluid exposure. If the person is bleeding, always wear gloves and protective eyewear when giving first aid care. So when taking off the gloves, number one is you have to avoid touching the outer contaminated surface. And you have to slowly pull one glove off while turning it inside out. Place a glove in the palm of other gloved hand. Place the glove in the palm of the other gloved hand and then remove the second glove while turning it inside out. So, first aid kit is an essential thing that we have, what that we need to have in every home and in everywhere that we stay in. So, we have to consider purchasing a commercially available first aid kit or making our own. So, having a kit in your home, your car, and at your place of work is very essential to stay prepared, most especially now, and most especially in the Philippines, that we are prone into some disasters, into some typhoons, some earthquakes, and other phenomena. So, in the first aid kit, it contains the things here. First is the bandages, roller bandages and tape, sterile gauze, antiseptic wipes and swabs, absorbent compresses, antibiotic cream, burn ointment, mask for breathing, rescue breathing or CPR, chemical cold pack, eye shield and eye wash, first aid reference guide, That includes local phone numbers. It's a very good thing also that you have some local numbers in your phone. You can put it in your notes. So in times of emergency, it will not be hard for us to locate and dial some hotline for emergency purposes. So for the summary and conclusion of the topic, first aid, of course, we have to always remember the key points, the definition of first aid, the three P's, and the first aid that requires training, the first aid basics, and the first aid kit. And of course, as an individual, we have to contribute meaningfully to the society. So it is much better if we learn how to perform first aid, most especially that we are prone in different disasters and different natural phenomena. So we should not only depend on the medical workers, but should always depend on ourselves. So the first aid that we have tackled earlier is a very important or is an integral part of the society, and it really helps a life to be saved. And we should always remember that every life matter, and we should not take life for granted, of course. If we can help, we should help and contribute because a little contribution is a big help to another. So, thank you for watching this, and I hope you have learned something in this lesson. Thank you. Until next time.